Whatever photos have been posted on social media by many celebrities also, these celebrities don't look the same in real life. The biggest transformation you won't believe is not the physical transformation. The biggest transformation is patient getting their smile back. India में Shushruth, who is considered to be the father of plastic surgery, started practicing plastic surgery in 600 BC.
गाइज आज के एपिसोड में हम कोई कॉस्मेटिक सर्जरीज या ब्यूटी ट्रीटमेंट्स पे बात नहीं करेंगे. वी विल ऑल्सो टॉक अबाउट द इनसिक्योरिटीज दैट पीपल लिव विद ऑलमोस्ट एवरी डे. वी हैव लीडिंग कॉस्मेटिक एंड प्लास्टिक सर्जन डॉक्टर समीर अहीरे विद अस, हु इज फ्रॉम इवॉल्व कॉस्मेटिक क्लिनिक एंड एससी एस्थेटिक्स. फीमेल thinks about any cosmetic procedure, she has a lot of guilt carrying with it.
Most of my patients who undergo mommy's makeover, they have life-changing results.
Another very sensitive narrative that we've been seeing right now is if we talk about the LGBT community.
Many people do believe that hair transplant is going to look fake and natural.
Yeah. What is the real or the accurate pricing of a plastic surgery here in India?
Most of my patients whom I do operate, they are from middle income group.
One skincare mistake most people make daily. Hello guys and welcome back to another podcast of Milenge. I am your host Tamanna. गाइज आज के एपिसोड में हम कोई कॉस्मेटिक सर्जरीज या ब्यूटी ट्रीटमेंट्स पे बात नहीं करेंगे. वी विल ऑल्सो टॉक अबाउट द इनसिक्योरिटीज दैट पीपल लिव विद ऑलमोस्ट एवरी डे. कभी कभी द चेंजेस इन प्रेगनेंसी इन वुमेन बॉडीज, समटाइम्स इट्स मोर अबाउट hair loss treatments, sometimes it is about the expectations that we are portraying and looking at from social media, and thus we are expecting certain changes in how we look and feel about our bodies. And now to discuss exactly all of that, we will have a very honest, simple, organic and beautiful conversation with Mumbai's leading cosmetic and plastic surgeon, Dr. Samir Ahire with us, who's from Evolve Cosmetic Clinic and SC Aesthetics. So without wasting any more time, let's welcome Mr. Samir to our show. So thank you so much for coming here.
Thank you so much for inviting me to speak on plastic surgery and cosmetic treatments today.
So, my first question popped up in here. You chose this field, right? It's not just any other field, but it's a very sensitive and emotional field. So if we could get a little bit brief about your journey in this.
Right. Before, how did I choose plastic surgery as my specialty? I would like to tell what's India's role in plastic surgery.
100%.
Basically, इंडिया का प्लास्टिक सर्जरी के साथ काफ़ी पुराना कनेक्शन है. इनफैक्ट प्लास्टिक सर्जरी का ओरिजिन इंडिया में हुआ है. India में Shushruth, who is considered to be the father of plastic surgery, started practicing plastic surgery in the form of reconstructive nose reconstruction way back in 600 BC.
I didn't know this.
So it's like a rhinoplasty, which we call it as nose job today, was done in 600 BC. And after that, yes, modern plastic surgery has refined, and in early maybe 1900, 2000, early 2000, definitely reconstructive as well as aesthetic cosmetic plastic surgery has developed. If you ask me today, then cosmetic surgery is the most upcoming trending branch in medical field.
Wow.
Many new doctors are opting, they want to practice as cosmetic logist or dermatologist or plastic surgeons. Keeping that in mind, the reason I did choose plastic surgery as my branch was because it involves a combination of science, artistry.
Yes.
At the same time, it is the most realistic way in giving in improving patients' quality of life, as well as increasing their confidence.
100%.
जब patients कोई surgery के बाद मेरे पास आते हैं and they are happy, they are confident, so that is very rewarding for me.
100%.
Plus, the creativity, the precision, the planning involved in cosmetic surgery motivates me every day, and that is the reason I give life-changing results. अगर मुझे कोई example देना है तो I'll just tell you, in last 3 days I did 3 cases of breast lifting with implants, and I did improve my results in each patient, which made me very happy.
And that is beyond any earnings or financial, interest involved, right? It's way above than that.
Right. So that is the thing. You need motivation. Money you're going to get, but then you need to be happy and you need to enjoy what you're doing.
Correct, correct. But sir, you meet so many people, you meet so many patients, and people have their own securities or insecurities in their own way. And there is a lot of emotions that they're trying to hide between that. So, do you see that in your patients? Is that evident?
यस यस काफ़ी पेशेंट सिर्फ फिजिकल अपीयरेंस चेंज करने के लिए नहीं आते ऑब्वियसली अपीयरेंस एक विजिबल रीज़न है बट उसके साथ पेशेंट के काफ़ी इनसिक्योरिटीज़ कॉन्फिडेंस सोशल एंजाइटी सोशल इंटरेक्शन ये सारी चीज़ों का एक इमोशनल लेयर छिपा हुआ आता है
Correct.
जब पेशेंट्स कॉस्मेटिक सर्जरी के लिए आते हैं when they tell their securities you won't believe they tell they are not able to look in mirror, they are not willing to take photos, they are not willing to wear certain kind of clothes,
Clothes.
their confidence is down. Definitely cosmetic surgery helps them in a big way. The most common emotional pattern जो मैंने notice किया है patients में is they have done their research for so many years. They thought about getting this procedure done, but they do come to me consultation after so many years.
Oh.
This trend recently has changed. The reason being social media, influencers, they have seen your podcast or they have seen YouTube videos and then they have got that energy or they thought ki I'll also get the procedure done.
Correct, correct. They do.
The biggest transformation you won't believe is not the physical transformation. The biggest transformation is patient getting their smile back.
Wow.
They their social interaction increases. Like if, for example, जब मैं पेशेंट जिनके हेवी ब्रेस्ट रहते हैं आई डू ब्रेस्ट रिडक्शन सर्जरी पेशेंट्स फील वेरी लाइट एंड दे गेट द स्माइल बैक दे आर मोर camera friendly. So all these things yes it plays at an emotional level but this is also very rewarding. And for me cosmetic surgery is not about just to increase your confidence.
Yeah.
And patient should not at all consider a cosmetic surgery as the only source of happiness.
Yeah.
They should definitely cosmetic surgery is one part but then looking good or having a good this thing body should not take down your confidence. You
Right.
should still feel confident with whatever body you have. You should accept it.
That's true. That's true. But sir, now that social media has come into picture, right? People have different sort of expectations. Do you ever feel like giving a very realistic picture to them when they have expectations like that?
Yes, definitely. See, I'll tell you, social media has set different beauty standards
Completely.
and completely yes, that
Yes.
is there. Because of the filter images or whatever photos have been posted on social media by many celebrities also.
True.
These celebrities don't look the same in real life, right? So if a patient is coming to me like they want this kind of results or their expectations are something and it's not realistic, I'm very honest with them. I don't budge to all the treatments what they want. They want to get it done, but then I'm very honest in educating them. I'm not going to give you a filter face, I'm not going to give you a fake unnatural results,
Right.
artificial or unrecognizable this thing body, but rather than let me give you something which goes with your body proportion and it looks natural, it looks refreshed.
Yeah. But sir, जैसे कोई cosmetic procedure के साथ they want to go ahead, right? What are the few attributes that matter the most? Is it trust? Is it comfort? Is it the certification or the experience of the doctor that they're involving with? What is it actually?
The most important thing on which patients do choose a plastic surgeon is the trust factor. And that trust is gained because of multiple reasons. That is, first is your surgeon experience,
Yes.
communication, safety, results and emotional comfort.
Correct.
Many patients who do come for cosmetic surgery, they must have seen some before after photos or they must have gone through social media platforms, seen some videos and then they think we'll get this procedure done. But when they finally decide to go ahead with the procedure, they want to feel safe, heard, as well as they want the surgeon to be experienced, to be
Correct.
technically skillful, and at the same time they want the surgeon to be very honest in telling them what is the realistic result you can expect.
Yeah.
right? Second is the communication part. Obviously patients do trust a surgeon who communicates openly. He will describe you all the procedure in details. He'll be very open with you about the risk complications involved, and at the same time he will do his part in going ahead with the procedure in a proper manner.
Correct.
Yes, emotional comfort also plays a very major role, because many patients have been carrying this kind of security insecurities for so many years, and so they do trust a surgeon who understands them and who listens and who can understand their insecurities. If you ask me what is one thing what on which the patient will choose a plastic surgeon or a cosmetic surgeon is if they feel uh, the doctor is taking care of their complete well-being, and he is not just oriented only on the procedure.
Oh, all
Right,
right.
so everybody wants to feel safe, they want to get natural results. So whoever wants a cosmetic surgery wants it to be done in a safe manner, as well as to get very natural results.
That's true. That's true. But sir, there's one very hot question that people tend to ask when we talk about plastic surgery or cosmetic surgery. People have this doubt that is it covered under insurance, and if yes, then what all part of it? So, what is your
Right. See,
say on it?
cosmetic surgery insurance में cover नहीं होता, because it is not a medical necessity.
Correct.
There are certain procedures in plastic surgery which we say as reconstructive are covered under insurance. Like for example, after cancer, if you are doing breast surgery, or post-traumatic, we are doing some kind of reconstruction, or post-burn, we are doing any kind of reconstruction. These procedures do come under insurance.
Oh.
But if you ask me cosmetic surgery, then you need to tell them cosmetic surgery is done for functional reasons. That means it is a medical necessity.
True.
Like if for example we do breast reduction surgeries under insurance, when we tell them ki it is done for functional reasons, because patients are having backache, they are having neck pain because of huge breast, and they are not able to do their daily activities. Second category of patients is patients who are having a big abdomen. Sometimes I have operated patients who are having abdomen till knee, and you won't believe they are not able to see their private areas also for many months. So these procedures, yes, insurance people do consider it to be functional, and they give us an approval. But
Oh.
finally whether we'll be getting a approval or not depends upon the policy and of the like whichever insurance company, and second thing, the documents which we are supporting it to be a medical necessity.
Oh.
If you ask me about insurance, then yes, there are outside India, many of the cosmetic surgeries are covered under insurance. But in India, not under personal, but in corporate insurance, they have started covering procedures under corporate insurances. I do expect 5-10 years down the line, most of the cosmetic procedures also will be covered under insurance.
So one thing was very sure when we were researching on the work that you've done. One interesting term that we saw was mommy makeover surgery, and very few surgeons in Mumbai, especially, have talked about this or is doing it. So, if for the viewers you could explain what exactly is this and how do you treat?
Right. See, I'll tell you, for me also, mommy's makeover term is very commercial.
Yeah.
But keeping that thing apart, right, mommy's makeover is not a single surgery. It is a
Okay.
combination of customized procedures. What we do to get back the body for a woman what she had before pregnancy. So usually isme what we do is we do 3-4 things, right? One is if they are having issues with the breast, like if it's saggy, loose, or the size is small, or if the size is big, we correct this. Second area what we address is the tummy area. If they're having loose skin, stubborn fat, or muscle separation, we correct this. Third is we do liposuction for areas in which they are not able to lose fat, like if,
Oh.
for example, thighs, buttocks, in spite of diet exercises. And finally there are certain procedures like we do for kind of genital aesthetic improvement, like vaginal tightening or labiaplasty.
Oh.
Now coming to the second part of your question, yes, definitely because of social media, more and more women want to do this procedure. They have become aware and they are more interested in getting a mommy's makeover surgery done. Also, because of whatever advanced technology we have, the results have improved, the safety has improved.
Wow.
Plus to that, we have such good equipments that has made this procedure very safe. That is the reason many women are getting it done these days. And because of social media, they are very open about it.
About it.
They do describe their journey. They do post videos regarding they got a procedure done and how was their journey. So this has been inspiring for many females who always thought of getting it done but did not had the courage to do this procedure. So
100%.
because of obviously because of social media and all these things, the number of patients what we do today has increased.
Wow. So, for say, as you just explained, this is something that goes after their pregnancy or delivery. So, I would like to double tap on that. What are the most sort of problems that women come and talk about, communicate about, especially after a delivery, that is seen the most? The pattern that you're seeing that is repeating itself, which, something, as you mentioned, something diet or workout cannot fix.
Right. See, there are many concerns which female have. I'll categorize into three. One is the physical issues. Second is the avoidance concern, and third is the insecurities regarding their intimacy. So, if you ask me, the most common physical insecurities or concerns females do have is first is regarding their tummy. They have done diet, they have done exercises, they have done all kind of workout. They are following all the discipline, but they are not able to go back, get back their tummy. So they are very unhappy. They do blame themselves why we are not able to achieve this. I like to say the reason why they are not able to achieve this is because there are some structural changes which are happening during and after pregnancy.
Correct.
So this structural changes are never going to recover because of diet or exercises. This needs some kind of surgical management or some kind of treatment. Like if, for example, because of pregnancy your tummy size increases because of the uterus, so your muscle separates.
Right.
And whatever connective tissue is there between the muscle, that is inelastic. So once your tummy goes
Back to.
uterus goes back down to its normal position, your tummy is not going to retract because connective tissue is not going to retract. That is the precise reason why you need a tummy tuck to repair your muscles. The second scenario is you have good amount of excess loose skin, stretch marks on your lower tummy, and you are doing diet exercises, you are not able to get rid of it. So the reason is the expanded skin is inelastic, it is not going to contract or retract. That is the reason a tummy tuck gets rid of that excess skin and you are able to achieve a flat tummy after that. Second concern is regarding, most of the times is regarding breast. When females do complain their breast looks deflated, they have lost volume from the upper breast, the nipple areola is sagging, they are having asymmetry, they are not happy about how it's looking. So basically a kind of lifting procedure is going to help them in a proper way. Plus to that, if you ask me, other things is because of hormonal changes, they have fat deposits in multiple areas from where they are not going to lose. They do diet, they do exercises, they lose from upper body, but they are not able to lose it from buttocks, thighs, lower tummy. So they need a liposuction for this area. The second part is regarding intimate insecurities or concerns because of the scarring or because of the weight, loose skin or breast. They are self-conscious and they are not that confident during intimacy. And yes, obviously because of all these concerns, till now many patients did not had an answer to this ki they could get a mommy's makeover surgery done. So they used to avoid many things like wearing swimming suits or wearing certain clothes or taking photos. They were not camera friendly, they had more so very less of confidence. So this was affecting them. And now because of mommy makeover surgery, all these concerns are taken care in a very good manner. So I'll definitely ask any female who is suffering from loose tummy or having breast issues to definitely research about mommy's makeover, and if they feel so, they can get it done.
Because probably a lot of women are going through that, but they've never addressed, or maybe they don't even know that something like this exists.
Right.
Right? So, but sir, whenever a female thinks about any cosmetic procedure, she has a lot of guilt carrying with it. And being a specialist or being an expert into this, probably sometimes it's your job to make them understand there is nothing wrong with expecting your body to be a certain way through the expertise that you carry. So, how do you explain them that?
See, obviously, there are going to be many changes in the body, and our society is made such. Many women feel pressurized to be grateful, to be resilient, and they keep all these securities with them unattended for many years.
Right.
So when they do come to me for consultation, I always say cosmetic surgery is about enhancement, but mommy's makeover surgery is more so about kind of restoration rather than enhancement. So if you're restoring your body back to your pre-pregnancy figure, there is nothing superficial about it, and there is nothing wrong about it. If you feel so, definitely you should go ahead with it.
Yeah, 100%. So, has there been any case where you think that somebody came up to you and they probably, came up with a minute issue which could have been fixed through a diet change or any fitness regime, and you probably advise them a solution which could have been naturally done? So, do you do that?
See, I'll tell you, there has to be a clear cut distinction between what is going to get corrected with nutrition, exercises, and what is not going to get corrected.
Okay.
Many women, they do follow certain discipline, exercises, nutrition, but still they are not able to get that results.
Right.
And they need to understand there is, they should not blame themselves for this. Because there are certain things like excess fat or maybe a little bit of mild sagging which can be corrected with diet exercises, which we do advise our patient.
Wow.
But certain things like structural changes what have happened in your body are not going to get corrected with exercises, diet. For this you need some kind of procedure which can be in the form of like liposuction, tucks, or breast surgeries, because they will correct the structural changes so that you can get back to your pre-pregnancy shape.
100%. And another very big narrative that goes along the line is that, would I look fake after the surgery? And you must have heard this a lot of times. So when people say that, how do you make sure, or how do you make understand your clients or people who come to you that everything that you're going to do for them, for empowering them in a way, would be natural to them, would feel natural to them? So what do you do about that?
See, I always believe in one thing. Cosmetic surgery is not about overdoing.
Yeah.
Right. So if you're delivering some kind of result, it has to look refreshed, natural. And the best cosmetic surgery work is done when it looks natural and nobody can identify you got a procedure done.
Oh, that's the beauty of it.
Yes.
Okay.
And yes, regarding your question, many patients who do come to me for consultation, they do ask me whether I'm going to look fake, whether it's not going to look natural. But then in mommy's makeover, actually we are not enhancing anything, we are just restoring.
Yeah.
And I believe these days cosmetic surgeons are not more of enhancers, but they are kind of more of sculptors in which they try to balance the normal anatomy. So rarely we do like overdo things these days. If any patient is specifically asking for us that kind of like it's all about when we do communicate with the patient, we ask them what is your expectation, what do you want, then definitely we do deliver that kind of results.
Because as you mentioned, clear communication was
yes,
the key.
see, patient, we just need one thing from the patient, what kind of results they are expecting. If they are very clear in telling us what kind of results they want, then definitely we can deliver that thing to them.
Wow. And once this surgery is done, what are the kind of, after a successful mommy makeover surgery, what are the kind of reactions do you get? Because even the smallest shifts or changes that you're doing to their body can change their lives or rest of their lives forever. So what are those reactions?
See, many patients definitely, I'll tell you just one example. One of my patients, she did post her before after photos on social media.
Okay.
So she was so happy with the results. Like she had posted photos of her tummy, which many Indian patients are still skeptical to post. Right? Some patients patients have come and told me they are now able to wear small size dresses or
Oh.
swimsuits, so they are very happy with the body. And I always tell my patients, you don't have to be perfect, you have to be confident whatever body you are having. So definitely mommy's makeover surgery gives them a kind of a new rejuvenated look, and they are more confident in life. They are able to things what they were not doing it, like because of the concerns they had.
Yeah.
So definitely it drastically like it changes their life. And most of my patients who undergo mommy's makeover, they have life changing results, so they are
Wow.
very happy with it. And definitely they become more healthy after this. So that is also one thing patients should consider. This is not just about the look but also your health.
Yeah, 100%, sir. And the kind of, rest of the life, that the expression and the confidence that they are carrying, I'm very sure they have that gratifying emotion towards you.
Yeah, right, because most of patients who do, they are very pleased, and basically they have been suffering from all these things since so many years. So
Yes.
getting relieved from this and then getting the best kind of results, so that adds on.
Yeah, it's like a cherry on the cake.
Yes.
But sir, other than that, I would like to tap on the another tangent here, that if we talk about breast surgeries, it's quite common now in India. And if we could little bit share this, that who is actually opting for it today?
See, I'll tell you, breast surgeries are very common these days in
Hmm.
India. As I'll tell you, maybe 10 years
Hmm.
back, I used to operate one or two patients for breast implant, but today I'm doing somewhere around 5 to 10 cases per month.
Oh.
So the number has gone up,
Hmm.
and also the demographics has changed. Previously, we used to operate patients who were rich, who were affluent, but these days, many normal from this middle income group do come to me for surgeries.
Trends have
And
changed.
yes,
Yeah.
obviously, and more patients have become aware, and they
Hmm.
know this is safe and this can change their life.
Yeah.
So that is the reason many patients are enrolling for breast surgeries. Those who want to get it done are patients who are having issues with body proportions, like if they are having small breast or maybe big breast. Patients after pregnancy, after breastfeeding, they have changes in their breast, so they want to correct it. Many patients are having asymmetry. Some patients are not happy with the way their breast looks, they want to get it rectified. So all these patients do opt for breast surgeries. Also because of the advanced technology, or many doctors many people are coming into in this field. um, Many patients have kind of getting a breast surgery done has become very accessible to them. They are
Oh.
able to get it done at their place which is nearby to them,
Nearby.
which was not possible maybe 5-10 years down the line.
Correct, correct. But so this is one part of it, and I mean, surely you're doing great work for people. Another very sensitive narrative that we've been seeing right now is, if we talk about the LGBT community, that we are seeing the whole expression on even Supreme Court level, or be it social media. So when there is a case like that, how do you treat it, and how much of sensitivity is involved in it?
See, these days, because of the awareness as well as because of the acceptance, many patients are opting for procedures, and also LGBTQ community has become more aware about their healthcare needs. So they are coming up, they are having confidence in getting procedures done. So the role of surgeon when some patient does come for a gender affirming surgery is first not just to do a procedure but to make them feel respected.
Yeah.
You have to make them understand what are the emotions involved in this, and basically get help them throughout their journey. The second aspect here is we do procedures for them. For example, if you are doing a male to female transformation, we do many procedures for them, like we do hair transplant, facial feminization, we do breast surgery, we do bottom surgeries, we do liposuction. All this thing is done, but then it all depends upon their choice what all things they want
They
to get
want.
it done, right?
That is also very subjective, people to people.
So that is also very important, what they want, and accordingly we should make a plan plan for them. So if anybody is coming to me for this procedure, we do explain everything. We tell them the realistic expectation they should have. We help them in making an informed decision, and we give them a very kind of safe environment, which is respectful. And plus to that, we do also help them in post surgery journey also.
Yeah, 100%. And I love how, beautifully you answered that with a lot of emotions, because I believe if you're treating something sensitive as that, there's a lot of emotional maturity you require, and that is not everybody's piece of cake. So another thing that I would like to ask you is, hair loss is something very common today, and when we talk about hair transplants, there are a lot of myths which are associated with it. So if we talk about if there are any procedures that could come up with more natural look, in a modern world like that, as per you. So what is your narrative on it?
See, I'll tell you the most common myth associated with hair transplant is many people do believe that hair transplant is going to look fake, unnatural.
Yeah, yeah.
So that was the scenario maybe 20, 30 years back, when we did not had that kind of advanced technology. But these days, if it is done by experienced plastic surgeon, and if it is done in a right way, keeping your face age in mind,
Yeah.
designing a very good hairline, then it doesn't look natural, unnatural. Plus to that, it doesn't look artificial. The precise reason is these days we have all the modern technology. We do proper planning for the hairline.
Bilkul.
The way in which we extract the grafts, we insert it, the direction, the density, as well as in patient selection. If we are selecting a good patient who has a good donor area, then all these things definitely will land up with good results. These days, if you are doing hair transplant, most of the patients, they completely look natural, and nobody can recognize they got a hair transplant done. People just recognize they have got a fuller hair on their head. That's it.
That's it. So it also matters from where you're getting it, right? Or the kind of expert that you're engrossing yourself with.
See, obviously, you need a qualified surgeon for that. You must have read in news these days. There are so many clinics who are doing hair transplant. They don't have the expertise, as well as they don't have the qualified person who are doing it. Yes, these people do end up with complications. These patients do end up with inferior results.
Correct.
But then, keeping that thing apart, there are still many more clinics, hospital, doctors who are doing very good procedures, and they are giving excellent results.
Wow.
So we should always look at the positive side.
100%, 100%. So another thing that I wanted to talk about is कि there is one taboo, or probably I can say there is one a statement that people say कि plastic surgery तो बहुत expensive होती है, and it's not everybody's piece of cake, or they cannot get it. तो आप being an expert in this field, आप क्या कहेंगे? What is the real or the accurate pricing of a plastic surgery here in India?
See, I'll tell you, plastic surgery definitely costly hai, but you should understand, if you are looking for cheap options, then that is not a right way, or that is very a dangerous way to go ahead, right? Because plastic surgery is going to be costly, because there are so many factors involved in it. First is your surgeon experience. For example, if any surgeon who he has done his basic course, after that he has done his specialty, super specialty, and you are going to pay more to him. The reason why you are paying him is for his expertise, as well as the safety what is involved with him.
Yeah.
Second thing, when we do plastic surgery, we keep minimum standards, like we do it at a accredited hospital.
Okay.
We have proper OT, proper anesthesia, proper emergency backup, and that is going to add to the cost.
Okay.
Plus to that, whatever instruments or implants or this thing we are using, these are all imported. The breast implants we use, they are all imported. Suture materials are all imported. Laser machines are all imported. So obviously this is going to add to your cost. And yes, plastic surgery is one thing, and cosmetic surgery do expect it to be more expensive. The reason is you need little bit of more learning curve in cosmetic surgery. And plus to that, if you ask me personally, I do charge good for body counter countering procedures because that is my forte. I have done so many patients for body contouring. So
Wow.
definitely because of my expertise, skills, and the result which I am delivering, right, I am going to charge little bit higher as compared to other people.
Hmm.
But previously I think patients used to think lot about like how much they want to pay, but these days patients care for their safety and they are more than willing to pay for the results.
Wow. So if you are getting one, then obviously that has a cost to it.
Yes,
Yeah.
and whatever results you are achieving, those results are going to stay with you for quite a long period. So this
Yes.
is a kind of investment what you should do for yourself.
So now, sir, that you've said about cosmetic surgeries, I want to throw a little light on. We talk about procedures like Botox, lip fillers, and skin procedures. So still, it is there and it's glorifying these days, but still, people have a lot of misunderstanding revolved around it. So if you could answer that.
So little most people feel that all aesthetic treatments are going to look fake and unnatural,
Mm-hmm.
but when it is done in a right way, they look very subtle and very personalized. The most common myth what people have is Botox is going to freeze your face, it's going to look unnatural. No, if it is done correctly, then it looks very subtle and you have those natural emotions. Other myth is fillers is only for lips, but no, we do fillers for under eye, nasolabial fold, jowls, and so many
Wow.
areas. Third common myth regarding them is the results are going to be permanent. Even surgical results are never permanent. So yes, but with modern fillers, what we are having, you can expect the results to long little bit longer, but don't expect it to be permanent.
Permanent.
And finally, if it is done by a qualified aesthetic professional, then you can expect a balanced, natural looking results, and most people won't even come to know you got something done for it.
Oh, but still, as you mentioned, people are very scared, and they're scared. And as you mentioned, that a good expert would know a difference between overdone work and subtle improvements. So, how do you see that?
See, basically, if you're asking me regarding Botox and fillers, then Botox are basically to paralyze muscles so that they become less active and whatever wrinkles you are having that goes off. Fillers are the other way around. They are for body contouring, for volume replacement. So if anybody is overdoing it, he is doing it because he is inexperienced or because patient is having unrealistic expectations. The way I do it is like when I know how much quantity to put and what is the right technique. You
Right.
must have seen in ads, people are promoting, we got 100 units of Botox done, we got 6 7 syringes of filler. That is not possible. I have been practicing for more than 10 years and have never put more than 2 or 3 syringes in a face at one time. I have never put more than 80 or 100 units of Botox at one time. So whatever thing is promoted is either because they lack expertise, they're not having that kind of experience, and obviously they will overdo it. But if it is done by aesthetic surgeon, you can expect it to be balanced, natural, and nobody does this overdo this these days. We do it in a very reasonable manner. Plus to that, always the technique is important, in the sense we don't inject all the filler at one time, or we won't be putting all the Botox at one time. We undercorrect it, we wait for 2 to 3 days, and after that again we ask the patient to come back for a touch up, and then we complete the treatment. So that is how we avoid overdoing it.
But sir, now that we're talking about overdoing, I want to cover a very uncomfortable question here. One thing that we very clearly see in celebrities sometimes, the work done with them is not how people expect it to be, even if they are agreeing or saying that they have done. The kind of work that they come up with is scary for viewers to watch. So, do they not have that perfect sort of expertise or a perfect, specialist that does, because they're celebrities, right? And people expect that obviously they have an exposure to a perfect specialist. Then why did that output, come out like that?
See, the basic reason is because of the expectations of celebrity. That is one thing. They want it to be in a particular way, and in achieving that, most of the times people overdo certain things,
Hmm.
right? But the best natural results are when we are not overdoing it, we are keeping it very subtle, we are keeping it very personalized, and even many people won't recognize ki they have done some kind of
Wow.
procedures.
Hmm.
So yes, there are some things like as I told you, because of maybe technical inexpertise or inexperience, or because of the expectations, sometimes these things can happen.
Hmm. So, do you sometimes kind of observe what changes any celebrities have gone through when you're watching them on the television?
See, it's my job to observe every phase. So
Yeah.
even now also I do observe and I do learn from observing. So
Oh,
once I see, I get to know what kind of things they have done,
what could they
and
have avoided?
what could they have avoided, what things was not needed. So
Hmm.
all this thing is there, but then I always tell my patients, it's your personal choice. Whatever you want, your surgeon is going to deliver that. So
Hmm.
if anybody is asking for certain treatment to be done and it is ethical, then definitely you can go ahead with it.
Hmm. Enough about this, but another thing that I really wanted to ask that if there things were in your control and if you could, stop a myth or debunk a myth here in Indian industry or maybe in India on the cosmetic surgeries, what would that myth be?
See, the biggest myth in India is cosmetic surgery is only for vanity, insecure people, or
Hmm.
rich people.
Hmm. Hmm.
But these days, I'll tell you, most of my patients whom I do operate, they are from middle income group,
As you mentioned.
and they want pretty much they want natural results.
Hmm.
The second thing is many people who are working in corporate life, who
Hmm.
are emotionally healthy,
Hmm.
confident,
Hmm.
successful, they want procedure to be done because they feel this can be corrected. They
Hmm.
have been keeping this at back of their mind. They wanted to get it done, and they have finally got it done.
Hmm.
Plus there are certain things what we say, if you are looking to get it done to improve your appearance, to improve your
Hmm.
confidence, to improve your social interaction, then definitely yes, you can go ahead with it. There is no vanity or something involved in
Hmm.
this.
Hmm. True. But also one interesting thing that is that few years now that we look back, we see कि the graph of how much people have started, integrating these things in their life has changed. जो पूरा एक taboo था, probably जैसे आपने बोला, the myth, वो बदल रहा है. And we see the graph, as you mentioned, middle class people, lower middle class, upper middle class are kind of engrossing themselves into it. So आपको इतना years of experience है, have you seen that pattern or that graph to be drastically changing?
Yes, because see, I'll tell you, when we started practicing, we used to if we used to get maybe 90 patients,
Hmm.
90% of my patients from rich affluent society.
Hmm. Hmm.
These days it's 60-40, with most of my patients are from middle age group,
Right.
this thing middle income group.
Hmm.
And plus to that, yes, because there have been so many changes,
Hmm.
the information what is
Hmm.
available because of Google, social media, or this thing, many people have become aware regarding this can be corrected, and this can
Correct.
be corrected in a very safe way,
Hmm.
right? Second is because of the whatever advances we have, we do it in very safe manner. We have improved the results, the recovery is short, there is no downtime. That is the reason many people are opting for this also. Plus to that, like I said, accessibility, many centers have come up, so they have started getting an option very nearby to them, which was
Hmm.
not there maybe 5-10 years down the line. Also to an extent, our society is changing. Whatever taboo or whatever behavior or society had regarding cosmetic surgery, they have started accepting this. And finally, yes, one factor which has changed is the affordability. The reason
Hmm.
is because of increased whatever you say GDP or increased standard of living. Many patients are willing to pay for these procedures, as previously they used to consider it is a kind of leisure and we should not opt for it. But that is not the scenario these days.
Hmm. Because now people tend to believe that if we have the exposure, if we have the finances managed, then why suffer when we have specialists like you,
Right.
right?
A- and the thing to it is, obviously they know this can be corrected, and
Right.
this can be corrected in a right manner, and whatever they are willing to pay or whatever is a financial thing, right? Obviously that is one aspect, but the kind of confidence, the kind of changes what they happen in their behavior, like they get their social smile back, they are more willing to face the camera, plus to that they have good eye contact, their social interaction increases. So all these factors is, I think, is very big as compared to what they are paying for all these services.
100%.
So what you gain at the end of the day by paying is something completely different.
Different. But now, sir, that you've seen so many cases, got involved with so many people who are coming with problems, their problems, and they want a solution to it, and your expertise on it. Has there been any case which was your favorite and the results were amazing?
See, I did a procedure for a 14-year-old boy. He was
Oh,
suffering from gynecomastia. He had chest swelling, and the reason his parents got him to me was he was not attending school.
oh.
He had a kind of a low self-esteem. He was not confident enough. He was doing bad in his studies. My policy is I don't operate any patients below 18, but then because his parents did wanted me to operate, I did operate him, and he got such excellent beautiful results.
Wow.
He went back to his school, he's doing good, he has got back his confidence, as well as his parents are also very happy they got this procedure done for him.
Yeah.
So this is how our society is changing these days.
And that's beautiful, right? That's beautiful. And
Yeah.
the kind of work you're doing, sir, that's angelic. Like, obviously, for a lot of people, it's their rest of the confidence, be it work, be it relationships, be it just social presence, is depending on what you're doing for them. So, once you treat somebody and the results are there, the procedures are completed, and when they come and meet you with that smiling face, how is that feeling for you?
So that is very rewarding to me, and
Yeah.
I'm very happy. Basically, we do practice for all these small movements.
Correct.
So once we that makes our day also. If we are getting this kind of video or we are meeting this kind of patient in a day, we are happy ki we have delivered such kind of results, and I plus to that we are helping them out. That is also one different feeling for me ki we have corrected it, which was like ki she had so many issues because of that, and that has been corrected. So it's very relieving for me, as well as it is a kind of motivation for me to keep on improving myself in delivering whatever results I'm giving.
Because, sir, it's not only physical or maybe confidence, it's also psychological. So when you were dealing this, you were working a lot on their psychologies for the rest of their lives. So that's amazing for sure.
Yes, because once they get a procedure done and they have that acceptance,
Yeah.
then definitely their psychology improves, their behavior improves, they are more confident, and
100%.
they can do good things, better things in life after this
Correct.
transformation.
Correct. And that will completely have a ripple effect to that.
Yes.
So, sir, before we end this, if anybody who's watching this right now and they're going through any sort of insecurities or any sort of, shifts that they want in their life or any procedures that they would like to have on their faces, on their bodies, and, they want a solution to it. So, what would be your advice to them?
See, I'll tell all my patients is if you're suffering from anything, try to find a solution for that.
Correct.
Right? How you can find a solution to that is first do your research, go through what is the issue, whether it can be corrected, and to what extent it can be corrected. If it can be corrected with all the safety, and you're having realistic expectations with what you're going to get at the end of the day, you should definitely go ahead with the procedure. But before that, do your research, don't much depend on social media, but see videos, you kind of educate yourself, and then take that decision depending upon your self respect and not self hate.
Yeah. And we would definitely put your details in the description just in case people want to connect.
Yes, thank you so much.
And before we end this, are you ready for a rapid fire?
Yes, please.
One cosmetic treatment people fear unnecessarily.
Botox, because they feel the results are won't look natural, it will look artificial and fake, but when it is done correctly they look subtle, personalized, and natural.
Okay. Natural beauty or enhanced beauty?
Natural enhancement, the reason is the most best cosmetic work done is when people see the look to be refreshed, natural, and not looking artificial, or they have got something done.
Okay. One skincare mistake most people make daily.
Avoiding sunscreen daily, because sun damage is one of the major causes for pigmentation and kind of premature aging.
Oh, one treatment currently trending massively in India.
If you ask me from surgical point of view, then it has to be body contouring, because many patients are have become health conscious. They are losing weight, so they need some kind of body contouring. And if you ask me non-surgical thing, then it is facial rejuvenation treatments like endolift, HIFU, Botox, fillers.
Okay. Hair transplant or skincare, what do people ask more about these days?
Hair loss solutions or hair transplant any day is going to be the most common topic.
Okay. One thing patients should never compromise on while choosing a clinic.
Obviously it has to be safety, because if you're looking for discount and trends and not looking for safety or qualified expertise, you'll end up in trouble.
Most emotional patient reaction you witnessed.
One of my patient who got a mommy's makeover surgery done, she was so elated. She had posted her photos, videos, everything. She had even described her journey in such a beautiful way that I was obliged that she like you this kind of transformation I could make for her.
Wow. One beauty trend you personally don't agree with.
Big overfilled lips or maybe exaggerated facial features.
Features. One thing people should stop believing from Instagram immediately.
Instagram results, or do it now, because these are not safe or neither these are medically correct.
Oh. One message for people who constantly compare themselves with others.
Basically, your confidence should not depend upon anybody's story, highlight, reels, or videos.
Oh, great. So thank you so much. That
Thank you
was
so
lovely.
much.
And the kind of answers that you gave were not only just any random answers, they were backed by logics, they were backed by science. So thank you so much for giving such real, authentic, and credible answers for all the questions that we had for.
Thank you so much. It was my pleasure for hosting me.
Okay, sir. So, guys, if you have any doubts regarding this episode, you can definitely comment, and our expert would like to take them. That's it for this episode. Thank you so much for watching Mike Milenge.